Hi, Dr. Tranchitella here. I was talking to a practitioner the other day through functional medicine clinical rounds, and we were going over some of her test results that she had actually done on herself. And I think it's a great idea as practitioners that if we're looking at doing new labs or we're interested in using a new lab, that we try out some of the testing on ourselves first so that we can see what those test results look like and how they might correlate to a clinical picture. There's so much testing out there, and a lot of it looks like it provides you with some really good information. And the information can definitely be useful, but we can lose the forest for the trees when we have too much extraneous information and we forget to get back to the foundational part of functional medicine and look at major core issues that might be contributing to some of those peripheral markers that really don't give us any insight into why they might be elevated or why they might be low. So it's really important when we start out with new patients that we always address the foundations first. And when it comes to testing, we know as practitioners that if we're going to order a test result, or if we're going to order a test, we're going to feel compelled to do something with the results. So we want to choose our testing judiciously, and we want to choose testing for our patients because a lot of them are paying cash out of pocket if they're doing testing from some of the labs that we use in functional medicine. So we have to choose the ones that are going to give us the most bang for their buck. So starting out with a new patient, I think it's important to always consider doing adrenal testing, adrenal salivary testing, looking at sex hormones, looking at thyroid function, doing a very complete GI analysis through something like GI 360 through doctor's data. A lot of people out there also like GI map, gives you a lot of good information so that you can do a full assessment of what's going on in the gut. So not only are you looking for pathogens and bacterial imbalances and potentially yeast, you're also looking at some digestive markers and inflammatory markers. So that helps us to understand if somebody is digesting their food properly, if they need some support there. That's very foundational. If they have inflammation going on, that can tell us what's going on in their gut, and that might impede absorption of nutrients. It might contribute to maldigestion, malabsorption, and just their overall symptom picture when it comes to their gut. So gut testing is very important, doing something like an organic acid test, which gives you about 75 to 80 different markers that can tell us what's going on a very foundational, functional level. And it gives you some things that you can really act on and address up front that can make big changes in somebody's health. Other things to consider like food allergy or food sensitivity testing and looking at gluten sensitivity. So these things are really foundational, and we have to have that in place first before we start going off into like second tier testing, like doing antibody testing for all kinds of tissues, or neurotransmitter testing, or amino acid testing, other things that are very specific and could be potentially affected by what's going on in the gut. So we have to look at those foundational things first so that we don't get pulled off in a direction that isn't really going to help our patients. Because as I said before, if we run a test, we're going to feel compelled to do something with that information. And if we don't understand why a marker is high or low, we could be taking them off in the wrong direction. So starting out with things to keep them very foundational is really important, because a lot of the extraneous things that our patients deal with come from thyroid, adrenal, hormones, inflammation, gut issues, sleep problems, and diet in general. So if you start with the foundational stuff, a lot of the other little stuff will correct itself, and you may not even have to go into that second tier of testing. If you do have to go into that second tier of testing, it means that you have addressed all of those foundational aspects and you've gotten your ducks in a row, so to speak. And then you can start going and looking for more specifics. And oftentimes when you do address those foundational issues, it clears the picture a bit so that you can see what the lingering problems are. It helps to clarify what direction you might need to go in. So address the foundations first, especially when it comes to testing, and the rest will reveal itself. So just give it time. Thank you very much.